Despite being treatable, TB still remains one of the major causes of death around the world. To tell us more about World TB Month, as well as some of the preventative measures, we are joined by Dr. Lucy Connell, TB Program Lead at Right to Care. A very, very good morning to you, Doc. Welcome to the agenda.
Good morning to you and good morning to all the listeners on this lovely Sunday morning.
It is indeed lovely. Better to have your mind as well on such an important topic this morning. Let's just get a sense of where we are here in South Africa. Give us some perspective. Over the years, has South Africa seen a rise or decline in TB cases?
We've seen both. So probably over the last 12 years, we've seen a sustained year-on-year decline in the number of cases diagnosed. We've seen a sharp decline in the number of deaths, and it's well researched. It moves in tandem with the amount of people we put on antiretroviral therapy, because as you know, HIV infection is one of the biggest drivers of our current epidemic. And as we make sure that more and more people have access to antiretrovirals and are well, and their health immune systems remain well, and we catch their infections before they deteriorate, we see a decrease in new cases year on year. Plus, we're reaching all the other people who don't have HIV. But although we've seen a decrease, we know we are still missing up to the tune of over 100,000 people every year. So that is the case. We have a declining incidence, but we are still missing people. But then when we talk about the year 2020 and 2021, we are reversing those gains. So for the first time in 2020, at the end of 2020, what we could see is the death rate all over the world from TB spiking upwards, including South Africa. And for the first time ever, there was a 19% decrease in the number of cases diagnosed. So on a background of decline, we have now had COVID, which has set us back. But the truth is, even before COVID, we were not doing well enough to end the epidemic by the year 2035, which is the year by which we want to see no more TB, no more deaths, right, no more catastrophic economic losses and destruction of lives.
So just to be clear, despite the gains made, South Africa still has one of the highest infection rates in the world, correct? Yeah.
Absolutely. We are right there in the top 10. And in terms of absolute numbers, we're right there in the top 10. In terms of when you measure it against the size of the population, we're up there in the top 3. So we really have one of the worst TB epidemics in the world.
So I just want to touch on what you just mentioned with regards to COVID, dealing with TB on one hand, and on the other hand, we're dealing with a pandemic, COVID-19 pandemic. How has the coronavirus pandemic impacted on the efforts to combat TB, especially here in South Africa?
Well, what we can see in the numbers is that we are diagnosing much less TB. We are managing to get fewer people on treatment. We are losing people who are on their treatment. More people are interrupting and not coming back to the clinic to get back onto their treatment. And we know that we are going to reap a holocaust in terms of failed treatment, illness, and death. That is what we're seeing. So it hasn't been the same throughout the whole pandemic. As the pandemic has progressed, we've understood, okay, this is how COVID works. This is how you get it. These are the measures you need to take to prevent transmission. This is what you can do to treat it. And as our populations become more and more immune through repeated infection and vaccination, presentations of COVID have thankfully become slightly milder. And so they exert less of a toll on the immune system, on the health system. And because of that, the health system is not as disrupted as it was in the initial months of COVID. But in the initial months of COVID, especially hard lockdowns, we had no people coming to the clinic, and we had health workers who were totally, all their bandwidth, their capacity, their thinking, their daily hours were redirected to fight COVID at the detriment of our other routine health services for our other big health problems in this country, which are HIV, TB, and the problems of mothers and children. So what we've really got to learn to do as a country, even when we are slammed with a new infection that we know nothing about, is to be able to chew and walk at the same time and never ever drop our routine services again, but see how can we work smartly to fight all these conditions.
You know, you spoke about the cases that are unknown as well, the missing cases. I wonder how much TB stigma contributes to that. Is that still very much a concern?
Massively. We know that because we've measured it in successive stigma surveys where we've asked people who've had TB how they feel about it, how they felt other people felt towards them. We've asked about people's attitude towards TB, and you get people talking about things like TB is dirty, having TB means you have HIV. I once heard Soul City share research on discussions with grade ones about their understanding of TB, and several things stood out for me. The little grade ones said TB is a sexually transmitted disease, or you can get it from sex. Obviously, they didn't use the adult language one would use. They said that you can get TB from the dust in the air, so it's very important to close the windows of your house at night so that you can't get TB from dust. And they also said that if you've got TB, you're also HIV positive. And we know that being HIV positive is massively stigmatized, even though, you know, sex is not stigmatized, and that's how you get it. So it's very hard, I think, for people actually to come forward and say, please test me for TB, or sometimes to admit in an environment that, yes, they do have symptoms of TB. And I think also there's not enough communication of the things that the country's research and the world scientists are telling us year on year. For example, I think that a lot of people in the public don't know that you can have TB, you can have TB disease, you can be spreading it to other people who share your air, but if you went to a clinic and they asked you about symptoms, you would say, no, I'm fine, I don't have any symptoms, and then they would not test you for HIV. So what we've realized as a country is that you cannot rely on the standard symptom screen where you ask someone about symptoms for TB to decide who to test for TB. And that's one of the big things we need to be doing.
So talk
we
to
need
us,
to be testing people who are potentially at high risk.
Right. Talk to us about that symptom screening and how it's done.
Okay, so from 2013 in South Africa, because we're a high TB burden country, the approach was that everybody who comes to a clinic for any reason, can be to bring your child for a vaccination, can be for a toe infection, or it can be because you are coughing and you have some sort of respiratory infection. Every single person needs to be screened by a doctor or a nurse who asks them about the 4 symptoms most commonly associated with a laboratory diagnosis of TB. So scientists have worked out, and this was in the past, that if you ask about those symptoms, you will be able to detect people with a high likelihood of having TB, and then you can then give them a laboratory test to determine whether they have TB or not. However, times have changed. Our disease profiles in the population have changed, and what we now know is that we picked it up in pregnant women, where TB is one of the biggest infectious killers of mothers in the pre- and postpartum period, that they can have TB. If you give them a laboratory test, you find it, but if you only symptom screen them, they will say no to all the questions because they're not yet sick. We also know that it's the same with people who are on antiretroviral treatment. They can be asymptomatic, they may have active TB, it's waiting to become worse, they are transmitting, but they won't trigger a laboratory test on symptom screen. And we now know that if you go and look for TB in the community using laboratory tests for everybody and using symptom screen and digital chest x-ray on top of that, what you will find is that 60% of the people you diagnose with TB will be asymptomatic, but they will have changes on an x-ray that suggest TB. So that is another thing the government is trialing at the moment, is the use of digital chest x-ray, which is interpreted by artificial intelligence. You can get a score in under 2 minutes that will tell you, Lucy has changes of in her lungs that suggest it might be TB. Then Lucy goes for a laboratory test for TB. And we need to be taking all the different methods.
Doc, how widely used is this artificial intelligence to interpret and score X-ray?
Oh, widely used. If you're a woman and you've been for mammograms, more and more mammograms are only being read by a specialist doctor if the AI picks up a problem. So already, when you go, and in fact, the future of radiology, where you're diagnosing what you see, is actually all to do with artificial intelligence. And in many fields, artificial intelligence readers, computers which can learn what different changes look like, are becoming more and more reliable, and in some cases better than expert human readers. And of course, they never sleep and they never get tired. So they already widespread in medicine. It doesn't rule out the human factor, but it means that in all levels, laboratory diagnostics of tissue samples, for digital chest x-ray screening tests like TB and mammograms, you can reach so many more people, and you don't need that huge human resources bill that we would have needed 15 years ago.
Look, Doc, there's so much more to talk about. I definitely want to get you back onto the program to talk about other issues, maybe zone in on children and TB, some of the structural drivers as well in terms of the increase of TB. But we thank you very much indeed for your time coming on this morning, especially on a Sunday. So instructive. Be well.
No, we really value the airtime that the media has given TB in the last week, and please continue. We've got a lot of time and a lot of messages to share with you.
Dr. Lucy Connell, TB program lead at Right to Care, talking to us about TB Awareness Month. Appreciate your time.